Next, we are going to see about sinus arrhythmia. What is sinus arrhythmia? There is a change in the rhythm of the heart, but it is still sinus. All of us, whenever we inhale and exhale, there is a change in our heart rate. This again you would have studied in physiology. When we all take an inhalation or an inspiration, there is an increase in heart rate. When we all exhale, there will be a comparative decrease in heart rate. So this is normal in all of us. That is why it is called as sinus. It is not due to a disease. It is normal, physiological. So cyclical alteration of heart rate can happen during respiration, and that can be manifested on the surface ECG as a rhythm change. So inspiration causes increased heart rate, exhalation causes decrease in heart rate. Why is this significant? Because these changes in heart rate are happening because we have an intact autonomic nervous system. In patients with diseases of the autonomic nervous system, for example, you take a diabetic patient, diabetic individual, advanced diabetes which was poorly controlled for many years, you have multiple nerves getting affected, your peripheral nerves getting affected. Similarly, your autonomic nerves also can get affected. In these individuals, if you take an ECG and see, absence of sinus arrhythmia will be there. This indicates autonomic nervous system is affected in this patient. So, absence of sinus arrhythmia is an indirect indication of autonomic nervous system dysfunction. And how do we label someone as sinus arrhythmia? I will show you in the subsequent slide. In case of sinus arrhythmia, I told you it is sinus. So, all the impulses are generated by the SA node. That is what is written here. All P waves are from the SA node. And certain situations, this inspiration causing increase in heart rate and exhalation causing decrease in heart rate is normal and common. But this might not be the case. So, inspiration and expiration might not be the reason for increase in heart rate and decrease in heart rate, or it is not cyclic alteration. It is a non-cyclic increase in heart rate and then suddenly there is a decrease in heart rate. This can happen because of digitalis. So, digitalis also can cause arrhythmia which is not cyclic. So, these are three ECGs. If you can see in all these ECGs, you are able to see a P wave over here, and then that P wave is followed by a QRS, and this is the T wave. So, PQRST, P followed by QRS and a T. So, the normal morphology and normal pattern of PQRST is preserved, but there is an increase in the heart rate. Approximately 150 will be the heart rate in this patient. Yeah, 150. You have two large boxes, so approximately 150 will be the heart rate in this patient, 150 to 160. So, increase in heart rate more than 100 with the normal preserved morphology is characteristic of sinus tachycardia. The next ECG shows you sinus bradycardia. You have a P wave, you have a QRS complex normal and a T wave. So, normal morphology of the PQRS is preserved, but the heart rate is very much decreased. If you see in this 7, 8, so 300 by 8, somewhere around 35 or so will be the heart rate in this patient. So, heart rate is less than 60, PQRS morphology is preserved. So, this is sinus bradycardia. The third one, if you see, you are able to see, if you want to calculate rate in this particular patient, it will be difficult for you. If you see here, the number of large boxes that you are able to see between the QRS is different, and if you see here, the number of large boxes is different. What is happening in this part of the ECG recording? There are closer QRS complexes, or the RR interval is decreased, whereas in this part of the ECG, your RR interval is increased. So, what is happening? There is an increase in heart rate here and a decrease in heart rate which is happening here. Again, if you see, after this increase in heart rate, again there is a decrease in heart rate in this part of the ECG. So, what is happening? This time the patient had an exhalation, patient inhaled and then again they exhaled. So, inhalation, exhalation is causing changes in the heart rate. This is sinus arrhythmia and it is cyclical. It is happening because of inhalation and exhalation in the patient. So, in this, if you take, now I would like to go back to this point. The difference between the longest and the shortest PP interval should be more than 10%. So, whenever there is a change in heart rate because of respiration, it will happen in such a way that if you take, this is the PP interval, this is the PP interval, compare that PP interval to this PP interval. The change in this interval compared to this interval should be more than 10%, then only you can label it as sinus arrhythmia. Okay, so this is a standard definition for labeling ECG abnormality as sinus arrhythmia.